A fracture is a break or crack in a bone.
How pauses like that, but just to kind of reiterate that, a break and a fracture are the same thing. Okay, the difference is a fracture is the medical terminology and a break is the layman's terminology. Okay, so depending on usually your audience you're talking to, patient, whoever it is, okay, I may try and speak more simply to someone instead of saying, "Oh yeah, you have hairline fracture, displaced, non-union, blah 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 blah." I say it's broken, okay, and let's progress down that pathway. Or depending on I'm talking to, let's say a physician, like, "Hey, I suspect um, a medial fracture on the tibia," and so forth. Okay, but just know that they are the same thing. Um, People like to think that they are different, like a fracture is worse than a break, or a chip is a break, but a fracture is clean through. What other things have I heard? I think that's most of them. But know that they are the same thing.
The nature of a fracture depends on the size, direction, and duration of the injurious force, as well as the health and maturity of the bone. Fractures are
I apologize for this.
classified as simple when the bone ends remain within the surrounding soft tissues, and compound when one or both ends protrude from the skin. When the bone is splintered, the fracture is said to be comminuted.
So this is for the most part the all different types of fractures. There's a few other ones out there. Just understand that. But this kind of incorporates the majority of them. Just know the difference between a fracture and a break is nothing. It just depends on who you're kind of like talking to, talking about that kind of thing. For the most part, a fracture is the medical terminology, where a break is the layman's terms. So just know that they are the same thing. A lot of people do think that there's a difference between the two. um, Things I've commonly heard is, oh, a break is a chip or a fracture is like all the way through, or different kinds of things like that. But that they are the same thing. The A little more about some of them is most fractures do require surgical repair. Okay, not all of them, because some green stick or impacted, um, stress, even they'll just put them in a boot or immobilize them in some way, cast, intense splint, whatever it is, okay, for X amount of time until it heals. Okay, usually about 4 6 weeks, sometimes 8, depending on the extent and so forth. Some like the comminuted fracture will require like internal hardware to kind of piece it back together. Same with the spirals for the most part. just kind of make sure all those different pieces stay together from all those different forces. Other times with some spiral ones, so like spiral fractures are super common in the radius, tibia, femur, and so forth. Some of those bigger ones, like the humerus and tibia, they will actually put a rod all the way through from one side to the other for some of these bigger long bones. Okay, and that kind of rod just kind of stays there for the most part their whole life. Sometimes they'll take them out, but for the most part, they'll stay in their whole life to kind of give extra support for that. Stress fractures are really kind of crazy in itself. Um, so stress fractures are super common in the lower extremity long bones. Um, I've seen them in every single long bone in the lower extremity. Super common with individuals who are really active with repetitive impacts. So this is the cross country, soccer, multi-sport athletes, long distance like marathon and so forth. Okay, those repetitive impacts over time can really result in stress fractures. So stress fractures is it's not really an acute injury. It's more of a like long term. Why am I drawing a blank on what it's called off the top of my head? Excuse me. But a long term like light stress that's applied is really not good for like the bones. So a lot of times you'll have a stress fracture, which is so minute that X-rays don't pick it up until about 4 weeks after they start experiencing pain. So, but if they keep progressing on it, like still running or whatever it is, that stress fracture can change to, let's say, an impacted or green stick or spiral or however it is, um, unless that person stays off of it or doesn't stress it, okay, to whatever acceptable amounts. What's crazy about it, so if you suspect a stress fracture and that individual has that mechanism, that repeat, constant, like impact, you pretty much have to shut that person down for 4 weeks. And then when you send them in to get x-rays, um, you'll see almost like that little, that scab formed on the bone. So all those, I'm drawing a blank right now, osteoclasts, okay, are forming that kind of callus on that bone, and that's what you're going to see after about 4 weeks. What's kind of crazy is like you're just it's more of a suspected fracture, but you have to shut them down because more often than not it is. Um, I've seen a lot of fractures clinically, working as an athletic trainer at a local high school here in Clovis, and those epiphyseal plates, those growth plates, that when that individual is going through that growth spurt, so this is going to be that eighth grade, freshman, sophomore year of high school for the most part, those growth plates at the end of these long bones, which are located roughly about right in here, okay, in some spots here on this tibia, are really susceptible to a lot of fractures. And whether it's a green stick or not, I've probably seen all of these at the high school level, and it's so common that I would see at least a fracture a day. Okay, sometimes more, sometimes less, hopefully, but it's just so common to see multiple fractures on these kind of adolescents. Okay, and so with those growth plate fractures, they're called Salter-Harris injuries or fractures. The Salter-Harris ones, there's 5 different classifications. One's not better than the next. Um, if that growth plate is damaged, it can close prematurely, which will stunt all growth in that area. So you may have, so this is a tibia here, I just know because it's the malleolus that sticks out on the side. If that growth plate closes prematurely, growth will stop in this bone. Okay, so this is the tibia. The fibula may still be growing, so you could have that longer fibula over here after 6 months, a year, maybe a little bit longer, which could affect their growth and so forth. Okay, and also compared to their other non-injured leg, which is still growing normally. So now you're gonna have leg length, some other weird issue going on with the tibia and fibula not being the same length, which could cause other issues. Okay. Um, wedge fractures here. I haven't seen too many of these, especially with flexion because of the spine. So this is the anterior part, this is the posterior part. I haven't seen too many crush on them flexing anteriorly. I see a lot of them flexing posteriorly, backwards, the opposite way of what this is going. So what happens is This isn't like the best depiction of the spine, but the spinous process is a little like things that stick out. This is what you can feel in the back. They come down a little bit farther in here. And so when you extend back, instead of these separating, they will go towards. And so this tip right here will hit the top of this one. Okay. And you can have damage to either one of those. So you could have a lot of these different fractures and other different spots through there um, in events like backstroke, swimming, pole vaulting, and what's the other one? I think there's one more. I can't remember. But a lot of gymnasts will get a lot of these just from that extreme back extension that can happen. Okay. A lot of these are termed spondylolisthesis or spondylitis fractures, depending on the extent of the damage in there. Trying to think anything else with these. For most fractures, if you're ever doing any kind of like clinical evaluation, whatever it is, usually the fracture is the first thing you would identify after like ruling out life-threatening items. But some of these can get really kind of intense. Impacted fractures where that kind of stress is going into one another in there. Femur is a really common one for this. That can be really, really bad, especially with like auto accidents. So you gotta think you're sitting down and you collide head on with another car in front of you, and your shins are going to hit the dash. So maybe significantly hard. So that stress going all the way through your femur, even though the femur is one of the hardest bones in the body, I have seen 5+ femur fractures clinically in my life, which they can be significantly terrible. Okay, one, even though this is a humerus, not a femur, but with the femur, there is massive items, blood vessels going just immediately to it. Okay, you have your femoral artery, vein, and nerve traveling just immediately of your femur, which with these major stresses going through your femur, a lot of times with this impacted fractures, you'll have these like on bone fragments that'll stick out to the side or sharp items. And if it's a not non-union, but if it's if those both ends of those bone are not intact, okay, there's nothing structurally to keep them apart. So this whole like lower extremity will kind of shoot up, okay, and it can potentially shred through those like femoral artery, vein, and nerve, which can severely impact your life, okay, because that femoral artery is massive, and the blood loss, especially if it's an open fracture, is crazy. If it's internal bleeding, just in your thigh alone, that's enough to put you in hypovolemic shock, which is shock from loss of blood flow, just because so much blood flow can accumulate inside your thigh. So that shock can be so extensive that it can actually kill you for this blood loss internally. All right, I think I am done talking for this recording.